Hello and welcome to our webinar series kicking off 2026 with Arrowhealth Bridge and with MetaPhy Health. Today we're joined by two experts in referral management who are going to be talking about two different sides of the equation in the referral environment, where we'll be sharing more information on how you can better close the loop and secure your bottom line with better referral management this year. We're joined today by two leading experts in healthcare, Chris Oubre of MetaPhy Health and Rick Mirell of Arrowhealth Bridge. I'm going to let the two of you introduce yourselves before we dive into today's content. Chris, would you want to kick us off?
Sure. Thanks, Courtney. Thanks for putting this together. Yes, as Courtney mentioned, my name is Chris Oubre. My day job is the president and chief operating officer for a company here in Nashville called MetaPhy Health. MetaPhy is a chronic disease management services company. And we really focus on the services side of healthcare and the chronic disease management space, leveraging technology to really try and improve overall clinical, operational, and financial outcomes across the entire healthcare continuum. And we depend on companies like Arrowhealth and Bridge to do that. So I've spent probably the last 19 years in both the technology and the operational sides of healthcare, looking at ways we can merge those two together in an effort to really fundamentally change how we provide patient care and improve the overall patient experience. I also invest and sit on the boards of several other healthcare services and healthcare technology companies. So this is a challenge that everyone is trying to solve.
That
Excellent.
is very true. Rick, do you want to tell us a little bit more about who you are and what you do?
Sure. Thanks for having us. Rick Mirell. I'm the co-founder and president of Arrowhealth. We've been at this for about 8 years. We originally launched the company for, independently very personal reasons, but we all sort of rallied around those personal reasons. And at the crux of it was making it easier to move around our own family members' healthcare information. And so we've had the privilege of working alongside and for companies like MetaPhy Health, trying to simplify that process and enable their value. And so we work with healthcare services and technology companies across the country. And our focus is enabling their value so their full user experience can be realized by the end user, no matter what platform that end user is working out of. And by way of Arrow Health, I've been in healthcare for about 15 years, predominantly in the growth area around healthcare technology. So excited to have the conversation.
Yeah, I've been looking forward to this conversation for quite a while, so I'm excited that we're all here chatting today. And I know that the two of you work together and you've done a lot to innovate in this space together. Before we dive into the state of the state, what's going on in referral management, and where are some of those challenges that hospitals, health systems, and specialty provider groups are facing right now, let's just take a little poll in the chat. And if you could drop your current challenges or wins with referral management, that would be great. How are you currently managing referrals, and what do you see as being a gap in referral management for your organization? And while everybody's adding some of their feedback, I'll ask you, Chris, to maybe give us a little bit of an overview of what's happening in referral management right now from your perspective as a company that's really reliant on referrals from your physician partners.
Yeah, that's true. We do, and I think the good and the bad answer is it's very different. All over the country, all over different practices. So today, MetaPhy is working with over 600 providers and 65 physician practices all over the country, and they all do it a little bit differently. And so, in our world, the referral process, if I think about that in terms of step by step, it really touches lots of different people at different stages, right? So the provider has a role, the patient is involved. In our case, the clinical team is involved in sort of managing, all aspects of that referral process. And, it really starts with the provider. And we want to try to meet them where they are and provide a referral process with as little friction and as much integration into their daily clinical workflow as possible. And so we found that the Arrow Bridge tool really helps us do that, right? It provides some clinical value on the front end. We can talk more about that. Operationally, very easy to integrate, easy workflow, easy from a technology standpoint. And then, from a financial standpoint, it really sets the tone for long-term patient engagement by giving the provider reminders along the way of what they need to do in the referral process. And so we see it touching all of those places, and which has been sort of a game changer for us in all the practices where we use it across the country.
I think that leads us really nicely into the conversation about the business need for better referral management solutions. Rick, you talk to companies, Chris included, but companies like Chris's and also other spaces within healthcare that are reliant on referrals. What are you seeing as being the biggest driver behind change in referral management for some of those organizations? And what does that need look like? What's that ROI and financial impact that um, organizations are seeing when they have better referral management solutions in place?
That's a really great question. Chris pointed out that this friction point or this need around improving and streamlining referrals exists everywhere in healthcare. All of the sort of traditional mousetraps are in play. You've got faxing, you have customized order sets, you've got a lot of back-end data plumbing that it goes into each specific EHR, and they all yield sort of varying results. We're hyper aware of what makes our clients' value prop different. We think very highly of Chris and MetaPhy. And if you spend any time with them at all, you realize that the people involved in managing those patients are a big piece of that, right? And I don't mean to double click too much on that, but truly it's the relationship that in MetaPhy's case, the relationship between the patient and the MetaPhy care manager, and the relationship between MetaPhy and the provider, and the relationship between MetaPhy and the payer. And so when we think about all of those folks that are involved, and it all leads back to improving the patient care, a fax, a portal that you're asking a provider to go to, or a staff member, or an order set that's really brittle and often breaks when there's an update to the EHR that they're working in. So, those traditional methods of asking an end user to deviate from their native workflow, oftentimes that alone is just enough to prevent the referral from happening in that moment of care. And the follow-up with the patient from that moment of care, whether they're seeing their specialist or their primary care doc, and they're having a conversation about improving their health and making that referral, the timeliness of that referral, that outreach to that patient is key. And to do that, so to get those real people at MetaPhy and the technology they've invested with, engaging with that patient and getting them into the program, you don't get that in a standing order in sort of a black and white button in an EHR. And so one of the things that we feel we do really well for our clients is we illuminate what makes them different. We bring their brand, their voice, everything that they know that is specific to that patient, that makes it the best possible candidate to go under their care. We put it effortlessly in front of the end user so they can make that informed decision.
It's interesting that you bring that up because I think that we've all seen our own referrals for our own services that we're receiving from different providers get lost even within the same health system. So when you think about the friction that can happen when you're referring from a specialty provider or a health system to an outside partner, if you don't have a really seamless way to make that referral happen, there's probably a lot of leakage that occurs. Can the two of you share a little more insight into the cost of that leakage and what happens over time if you're not able to capture, like what is the revenue impact when you can't capture all of those referrals that should be coming your way?
I'll take it from our side and talk about some real world examples that we have. Um, and I would start with the fact that every patient encounter is important. It's important clinically, it's important financially. And so when you think about the value of a lost patient, it can be the clinical care that that patient is receiving. And then also obviously the financial implications of not having that patient encounter. And so I think that there are a lot of sort of value related touch points involved. But where we have seen Arrow and Bridge most successful some of our specialty practices, especially where the specialists are really focused on what they do every day. They are, they're coming in the procedure room, they're coming in the patient room, and they sort of have their routine down and they know what they do and they've been doing it for years. And so introducing anything new, Rick talked about friction points or asking people to do things differently is always a challenge. So where we have implemented Bridge and just integrated into those existing workflows, we've seen an increase in almost 40% in patients that ultimately get referred to us,
Wow.
ultimately get managed, ultimately get the care they receive, and ultimately get to follow through on following that patient through the care continuum. So we've seen significant changes and just having a tool there that to Rick's point sort of illuminates, hey, this is an option for this patient. Click this button, mention this talk track, and it just changes everything about how the patient is referred out from that point forward.
And that also speaks to greater access to care in an environment where you hear all the time in the news about the lack of access to care and the wait times to see certain providers. To be able to immediately extend that level of care to a patient is something that most physicians are looking for. So to have that immediate referral happen and have that process get picked up so quickly, that has to be an additional benefit to them and the care that they're providing, I would assume.
That's what we're hearing. We're hearing it from both the providers and the patients, right? That access to care, you mentioned that. Medicare says that's one of the three biggest challenges facing healthcare today. Is that access to care, closing that loop, making sure that once a referral happens, that it actually happens, right? And the patient actually gets to this other location or other episode of care. And so, again, making that seamless, making it easy, being able to close the loop on making that happen has been transformative for us for both, again, a financial value but equally so from a clinical value to these patients.
Rick, when you think about the systems and the solutions that are acting now to solve the referral gap, what is causing them to make the decision to change the way that they request or partner with different organizations in healthcare to get those referrals, to put a solution in place that's a little bit more seamless for referral management? What's pushing them across the finish line to help them make that decision to move forward with you?
It's a great question. There's no one single answer, but we do see a reoccurring theme, right? And so part of that theme is, Chris alluded to it in the closed loop. Oftentimes, provider or recipients of the referrals struggle not just getting the referral, but communicating back to the referring provider and their team about what happened to that patient under their care. Did that patient ever come into their program? Um, we discussed sort of the mousetraps to get a referral in. It's
Mhm.
even worse communicating back. It's a fax or a secure message, or it's going into a random inbox, or, in a case of like vitals, it populates in a blood pressure box in a chart that the provider is not going to go back and look at until that patient is back in 6 months or a year from then. So one of the strengths is to that really impressive 40% that Chris mentioned is the ability to inform the referring provider what happened to that patient under their care and removing that perception of a black box. That is a big struggle for most healthcare provider groups. So that's one. Two, oftentimes, again, we talk about extending sort of the value prop and what makes you different and stand out from the other vendor partners that are servicing those provider groups. Healthcare has been moving more and more to an outcomes-based environment, and I think that's really healthy. That's very hard to communicate in even the best of marketing materials and getting a referring provider to remember that. Because when they're looking at their patient that's in front of them in that moment of care, they're not, I promise you, they're not thinking, Chris has this type of insurance. And I know Chris, right off the bat, historically has these chronic conditions, and may have sat through and even read all the outcomes-based information that this is the efficacy of their program is top rate. But in that moment of care, they're thinking, this patient needs care management. What we do is we give an informational box that gives the 1, 2, 3, or 4 points of this is why you should send your patient to MetaPhy. And when I say we, in this example, it's MetaPhy. We're just creating access. So that also helps more of an informed decision. And then to sort of put a bow on it, not just the referral and presenting the patient care information back, but it's also insights. So one of the things that Bridge is able to enable for MetaPhy is mutual visibility for both the referring provider organization and MetaPhy about how many eligible patients are truly being referred. And that
That's
opens up a completely different way of managing the relationship with your referring provider group.
That's pretty incredible and obviously super innovative. And I'm sure that those are two of the things that Chris saw when the two of you started talking. Chris, can you walk us through the process of identifying that there was a need at MetaPhy Health for the solution that Arrowhealth Bridge solves, or for the solution that they provide?
Yeah, I mean, we're constantly, again, as a services company, we're constantly looking at new and innovative ways to leverage technology. And we don't want to build technology. We want to buy it off the shelf, and we want to partner with folks like Rick and his team who can help us solve real world healthcare problems through the technology that they've built. And so, when we think about the real life problems we were trying to solve, we're trying to work in what is really a broken healthcare system. I mean, healthcare today is difficult. And it requires some new ways to think about how we address, again, I talk about all three, the clinical, operational, and financial challenges that we see. And so, we read articles all the time about healthcare being disrupted. And if you believe that, healthcare is in a state of disruption, I have a good friend who talks all the time about, in an industry being disrupted, experience can be a liability. And so for those of us who have been doing this for a long time, we need to think about healthcare differently. We need to think about healthcare solutions differently. And so it was that sort of catalyst that got us talking to Rick and the Arrow team. And we were bringing real world solution problems to them so that they could help us with real world solutions through the tool. So, when I think about, you mentioned access to care. Today we have providers and nurses who are, being asked to do more with less. Reimbursements are shrinking. Every patient experience is important to everyone involved. And so those were the kinds of problems we were trying to solve. And Rick and the team have just been great at helping us, number one, understand these problems in detail, and then applying technology solutions to help us solve them.
Tell us a little bit more about how your team was able to solve this problem for the MetaPhy Health team, Rick. Like what happened once they engaged with you?
Well, it takes a really good dance partner on the other side. I mean, Chris and team really deserve a lot of credit here. There's a matter of trust and communication and also being vulnerable, and trusting us that we're here for the right reasons. And I think that from the very beginning, we were both very clear that we wanted to align incentives. And when you do that, everything else just kind of snaps into place. We feel like our level of expertise is continuing to grow in how to enable the value props of our clients, but we never think we're the expert on the other side of the relationship. So I bring that up to say that Chris's team is in a position to give us real-time feedback about the patient journey that really impacts how that referral is provided and the information that is going back. So, one example would be, Chris brought us a clinic that was a longtime clinic, a really good provider group, referring provider group for them. And it just felt like it was kind of on autopilot. And Chris was adamant, hey, we'd like to get Bridge in there. We want our MyCare Easy Button app up and running. We've met with the physicians and the staff, and we feel like there's a lot of opportunity to improve patient care. And Bridge enabled their MyCare app. And the very first month, they had, just over 300 new patient candidates be referred into their program. When I say referred, that meant that the physicians in that practice clicked the refer button over 300 times in the first month. And ever since then, I don't think they've had less than 400 patients be referred. And so MetaPhy and their team are top of mind. And that type of collaboration really then starts to bring forward, okay, we can refine the program inclusion criteria. Now we have visibility into the patients. We know the patients we care for the best. We know the payer mix that works best for both the patient and for us. And we're able to take that logic and apply it in real time and give real comfort to the referring provider and Chris's team that they're getting the highest quality candidates.
Well, I'll add a little to that, and I appreciate all the compliments about the team. I'll make sure I pass that along so they all hear that. But again, I want to say I think the Arrowhealth approach to problem solving is much different from other, strategic partnerships that we have, in the sense that they didn't just have a tool and said, "Hey, here's our tool, here's how you use it." They really took the time and spent the time to understand the workflows that we were dealing with, the real problems we were trying to solve. And the ultimate solution we collectively delivered was a little bit different than where we started. We added some functionality that not only does the referral come to us so that we can respond in real time to the physician request, but we built in some patient notifications so that the patient knows that they were referred and that they can expect a contact from someone from our virtual care team. And so it was really back to closing that loop, solving real problems, but doing it in a way that was creative and collaborative. And not all technology companies are interested in approaching things from that perspective. So it really was a good marriage, right? But to Rick's point, we dated a little while and danced a little while before we got married, but once we did, it was valuable for both sides, and certainly for our physician partners and for our patients.
One of the things that I think really also makes this tool stand out is that it's branded to you as MetaPhy Health. It's your tool. It's not the Arrowhealth Bridge tool. That's not how it shows up in the EHR. It's another branding opportunity for you as a company, for those physician or provider partners. Do you think that that makes an impact for how you're perceived in the market?
I think so. We have, I would say, as a company, we really care about the solution and the care we provide. We don't care as much about whose name or who gets credit for what's being done. And so most of the providers and all of the patients who work with us don't know anything about MetaPhy Health. They know and connect to our MyCare program. And so, and the MyCare program is really provided on behalf of the physician practices we work with. So we sort of white label all of our services and all of our tools under that MyCare brand under the specific physician practice. I do think it creates some stickiness to the practice and not to us, which is fine. But by labeling and white labeling the MyCare Connect app as just another extension and another ingredient in the MyCare program overall, seemed like a very seamless way to integrate just another tool into our value proposition. I think it was very well received. It certainly made it easier to implement. And we just incorporated into this is what we do. Right? When you partner with MetaPhy, you have our MyCare coordinator with our virtual care team. You have our MyCare journey, which is our clinical content. You have our MyCare device for those patients who are using remote patient monitoring. And you have MyCare Connect, which is the app that we use for the referrals. So we just integrated all of that under the same umbrella and felt like it was very well received.
Do you think that there are new challenges that will pop up in 2026 for healthcare organizations that are dependent on referrals from provider groups, or do you think that they'll kind of stay the same for 2026 as what we saw in 2025?
Uh,
Kind of a loaded question.
predicting the future is not one of my gifts. But I'll go back to some of the things I said. Our healthcare is constantly changing, and so again, that access to care issue that we're trying to resolve, touching all aspects of that referral process from the provider to an outside team, in our case, and to the patient, is something everyone's trying to solve. And so I do expect more challenges will continue to pop up. And as it relates to this tool and to Arrowhealth more broadly, I think they understand that this we're trying to solve this as a process and not an event. All right, this is not something we do and that's the end of it. It's a work in process. It's a work in progress, and we continue to look at the environment, look at the landscape, look at the clinical workflows, and find new and better ways to upgrade and adapt the tool. So I think that differentiates us in a lot of different ways. And I have to thank Rick and his team for that, right? They have to have the ability and the thoughtfulness to be thinking in terms of, we've deployed a tool today, but how do we continue to make the tool better going forward?
I think I think we're also seeing an environment that has a lot of pressure on technology as the enabler for really everything across the healthcare continuum, from a regulatory perspective, from a provider experience perspective, but also from a patient perspective. Patients really expect to be able to log into an app and make an appointment or connect with their physician or schedule refills with their pharmacy. Thinking about it from that perspective, do you think that there's a clear case for companies in healthcare to invest in technology that creates a more seamless experience, whether that's referral management or something else in 2026? I think cost tends to be a barrier. And companies, look very strategically at what they're investing in for technology. Do you think that a tool like this or a tool that enables a more seamless patient or provider experience is essential to success moving forward? Or do you think that continuing with some of those older referral mechanisms or communication mechanisms is going to continue to kind of be the bar?
No, I think it will continue to change. And I don't know what it will change to, but we have technology, we have apps, we have AI, we have lots of different tools in order to sort of, again, we talk about meeting providers where they are, but meeting patients where they are as well. We have an entire patient experience team here at MetaPhy, who was very involved in the development of the bridge tool for us. And those people are waking up every single morning thinking about how do we create an exceptional virtual experience for patients. And that's the problem they're trying to solve. And they're constantly thinking of new ways to do that. And a lot of that is talking to patients and getting their feedback. Someone told me years ago, if you're going to sell ladies' shoes, you need to talk to some ladies. And so our
Groundbreaking.
folks, yeah, our folks really want to do that and get feedback from patients on, hey, here's how you like to get information. Here's how you like to send information to us. Here's how you like to be engaged. And so hearing that feedback, incorporating that into what we do is just sort of in our fiber and in our being at MetaPhy. But again, you have to have a partner like Rick and his team to help us do that. We as a company don't necessarily want to, as I said earlier, develop software on our own. That's not our core competency. We are a service provider. We have some of the best clinical staff, the most highly trained, the most engaged that we see in the space. And so we want to focus on that. We don't want to focus on building technology. We would rather partner with folks like Rick and his team who have that as their core competency and leverage that into what we do.
I think that's a very unique take because in health tech, we hear a lot from IT teams at healthcare companies that they would rather build their own solutions in-house. But oftentimes there is technology that exists that, is either faster or more cost effective or just, easier to access and implement by partnering with an external company. Rick, tell us a little bit more about why a healthcare organization would want to partner with Arrowhealth over building this type of solution themselves.
Yeah, I mean, so we are at our core a enabler of value. And so whether you are a healthcare services based company like MetaPhy, or you are your core competency is technology, you are, providing a SaaS solution to healthcare at large, our immediate value prop out of the gates is we reinforce your core competency, as Chris would put it. For technology companies, you focus on your core solutions that generate revenue and better outcomes for patients. For service-based companies, you get to focus on that patient experience and the relationship management with your clients. We focus on enabling what you do best at the fingertips of those referring provider groups. And, to kind of take it full circle a little bit, the question earlier reminds me of this, which is instead of going out and building your own technology integration stack to do something similar to what Bridge affords our clients, today, if you're receiving referrals or you're enabling your technology through faxes, back-end integration, or even you have a portal, or worse yet, but most common, you're relying on outdated reports, historical reports from your clients, we are the solution for you. When we think about service-based offerings like MyCare, that patient access team, their credibility and level to engage the patient in a meaningful way increases when they can talk to the patient the same day or the next day, not 6 months after they've gotten a report. If you have back-end integration and you've gone with the gold standard for a data plumber, there's no visibility in that pipe. When those referrals stop coming, you don't know if the clinic shut down for a holiday or if that integration broke. If you're relying on that perfect mousetrap that's being delivered through a fax, one of my favorite stories from one of our newest clients is they had a champion at a really large provider group, and she helped them put together this custom order set that then dropped to a fax, and she went out on leave, and it broke, and the referrals just stopped, and nobody else knew how it worked. And so we like to be the one to many. We'll do the stuff that nobody sees, that's really unsexy, but it enables value. You stay focused on what you do best with the patients. And I think from a provider side, most of them have no idea who we are. To Chris's point, they think of MyCare. It's an extension of their own practice. But those providers and the staff have real technology fatigue. And we see all types of solutions, AI scribing and billing, and everything's coming in. I think it's incredibly important that you start to blur the lines of their native workflow with really valuable solutions like MyCare. Because at the end of the day, they're just trying to deliver better patient care. And they're already logging into many different systems. And then I think on the patient side, if you're calling a patient 6 months after they saw the doc, it feels at best kind of like a cold call and at worst fraudulent. And so meeting patients where they're at through text messaging and apps on their phone and really prompt service with actual information about why they're being referred. I don't know the future either, but I think that's a good step towards it.
That's so interesting. I didn't even think of the fraud angle with all of this, that with those delayed points of outreach, that someone would not perceive it with how critically people look at phone calls that they get from people that they don't know or emails from people that they don't know. And everybody's now trained to just delete, delete, delete. Don't answer those phone calls if you don't know who they're from. If there's not a direct, immediate tie, people forget that they received that referral or that their doctor was going to send a referral. If they aren't contacted immediately and that referral isn't seamless, it's very hard for them to even remember to get the care that they need.
That's exactly right. We see that day in and day out, right? That warmer. We talk about the increase in the 40% that we've seen in certain places, and it's all about that that referral from the provider that is responded to very quickly and very timely, while it's still top of mind for everyone. If days and weeks go by, it's hard for these folks to remember, you know, that this is even happening and that they're supposed to expect a call or that they're supposed to go follow up for another visit. So I think the timeliness aspect of this is mission critical.
Well, I want to thank you both for joining us to talk about such a critical aspect, but often not talked about aspect of healthcare, which is making referrals work the way that they're supposed to. Chris, if anyone wants to get in touch with you after this session, how can they reach out?
Yeah, we'll provide my email address and we can do that. And so they can certainly email us. They can reach out to us through our website. We're happy to follow up and answer any questions or demo the system or give more information at any time. So we would welcome that.
Awesome. And Rick, how can people get in touch with you after this session?
Yeah, likewise. My email address will be in here as well as you can visit our website and happy to field any questions and would welcome an opportunity to demo our solution.
Perfect. If you look to the right in the chat, you will see a download card with both Chris and Rick's information, as well as some additional information, a case study on the experience that MetaPhy Health has had in working with Arrowhealth, and some additional materials that you may find useful as well. Please feel free to download those and reach out, and we'll see you next time.
Thanks.
Thank you.